Please, everyone, join me in welcoming Jon Ayers.
Thank you.
Thank you, sir.
Thank you. Thank you. Welcome to IDEXX VMX 2019. We serve a really attractive, growing profession. Pet owners are evolving, and practices are taking notice. Care is expanding, not only just for sick animal, but also for chronic, and even in the routine, regular annual exam, what we call the wellness exam, expanding with the introduction of comprehensive diagnostics. You see, as Eva said, pets can't tell you how they feel, they can't talk, and so diagnostics provides pets a voice in their health care. And IDEXX innovations expand their vocabulary. So why don't we take a little bit closer look at today's pet owner? In the surveys that we have done, 98% consider pets as part of family. 95% of pet owners say they can't imagine giving up their pet for any reason. And of course, this would include premature mortality, which is why preventative care is so important. 74% of pet owners say that pet ownership is good for their health and well-being. 42% of millennials and Gen Z say their pet has special health needs. And 75% of that cohort rely on their veterinarian for advice and maybe some metrics. And so in that context, we see how the emerging importance of adding diagnostics to the wellness exam starts to be important, and why we're beginning to see really 2019 is a year where this really takes shape across the industry. IDEXX recommends that a comprehensive diagnostic workup in a wellness includes 3 key elements: IDEXX Bloodwork, the Fecal Exam, and the Vectorborne disease screen. Let's look at the evidence for these 3 components, starting with the bloodwork, the chemistry, and hematology. When you run IDEXX chemistry and hematology, which we have done in this data study of 268,000 pets. That included an IDEXX chemistry with SDMA and an IDEXX CBC. We found that 1 in 7 adults had significant findings, 3 or more abnormal results and or an abnormal SDMA in their results, indicating the likelihood of emerging disease and the requirement for further workup. Remember, these were well patients that showed no clinical signs even upon examination and no evidence in their history. 1 in 7 adults, it rises to 1 in 5 for seniors and 2 in 5 for geriatric patients. The evidence here is compelling that pets indeed have a lot to say if we only listen to their blood work. The second, of course, is the fecal exam. The IDEXX fecal antigen panel picks up twice the parasites present in the pet from as compared to the traditional fecal flotation. This is our advanced technological approach, and it turns out even in the adult wellness presentation, poop has a lot to say here. And yet, many exams don't even include a fecal as part of the basic workup. The third element for dogs is the Vectorborne disease screen. Now, we all know, because CAP-C recommends, that the Vectorborne disease screen, which of course includes not only the heartworm test, but also the disease screen for the cohort of tick-borne diseases, is recommended as part of the standard annual screening process for all dogs across the U.S. And yet, less than 1/3 of the dogs that are on preventatives receive a Vectorborne disease screen. With IDEXX, you can trust our unique peer-reviewed accuracy with either the in-house, the SNAP 40X, or the reference lab version at IDEXX Reference Labs with Lab 40X. Very important part for the dog. Not relevant for the cat, but for the cat, we'd probably want to know retrovirus status as part of that workup. And then maybe we'd also want to include urine. But let's stay with the cat for a minute and let's look at a case study. So this is a very special cat named Reese. Reese is part of the Ayers family. Reese today is an 18-and-a-half-year-old domestic shorthair. She has been part of our family for 18 years, since before I joined IDEXX, actually. Very important family member, grew up with my kids who are now off and having their own lives with their own cats. And Reese, look at her. Now, Reese, because we're good parents, we've adopted preventative care protocols. We adopted it back actually before September 25, but it was in the annual workup in September 25 we had the first opportunity to have SDMA as part of the chemistry panel. And you can see there was an abnormal finding in the SDMA with a normal creatinine and a slightly elevated BUN, which most veterinarians, in absence of any other information, would not say is a cause for concern because of the nature of BUN being pretty variable. It wasn't until 2016, though, that my vet appreciated the importance of even a mildly elevated SDMA as a finding. And with this mildly elevated SDMA, of course, what action was taken? Let's perform a urinalysis. And in that urinalysis, lo and behold, we found not only a dilute urine, but also a marked presence of bacteria, which was later confirmed with culture and sensitivity and was treated. Reese came back. We cleared up the bacterial infection in 4 weeks, but we still had an elevated SDMA and a normal creatinine. The diagnosis in this case over that period of time was a urinary tract infection. Remember, Reese was perfectly fine. She wasn't telling us verbally that she had a urinary tract infection. It was actually her SDMA that was her voice saying, this requires further investigation, and then her urine told us about the urinary tract infection. And with the persistently elevated, mildly elevated SDMA, even with a normal creatinine, we knew we had also probably stage 1 or stage 2 chronic kidney disease, which is a perfectly manageable condition if you catch it early, which is what we did. And we entered into a treatment plan and a care plan with my veterinarian and my wife and I to make sure that Reese had the proper diet, hydration, and more frequent care so that she could have her kidneys outlive everything else and have a normal, full life with us. So it being 2019 at VMX, why don't we fast forward to where we are today with Reese Ayers? And it's very interesting to see that Reese has had regular care, and she's had some other issues along the way, but if we look at the SDMA and we look at the creatinine, we realize that other than a brief elevation of the creatinine, 2 years later, after the original SDMA that was run on Catalyst, we didn't have Catalyst SDMA in August of 2017, and then the creatinine went back to normal, and the SDMA stayed elevated, and it wasn't until November of 2018, that would be well more than 3 years after her initial SDMA elevation, that we saw a persistently elevated creatinine, which we all know is the traditional marker for renal disease. And in that case, in November, we had another urinary tract infection, which we treated, obviously, was acutely injuring the kidney, and now we probably have a stage 3 chronic kidney disease on our hands. But this is 3.5 years later. Bottom line is that because Reese was the beneficiary of IDEXX's advanced preventative care protocol dating back to 2015 and 2016, I am convinced she's alive today with us, still giving us love, having a full life. Certainly 18 and a half years starts to be a full life for a cat, and perfectly clinically normal, not telling us through her clinical signs, only through her blood work and her urine what was her health condition. And so the case for preventative care, the evidence-based case for preventative care is strong. The pet owners are evolving, are responding to this. We have progressive practices. I see a couple of them in the audience today who've really taken this to heart and seen dramatic growth in their practice by being able to provide this level of care. And so if you are a veterinarian and you're looking to either initiate or to advance your preventative care protocols using IDEXX's expanded and unique innovation that listens more closely to the vets and their health status, then you should contact your veterinary diagnostic consultant, because we are in the business of providing this advanced care for practices, for pet owners, and of course, for pets. So I want to thank you very much for joining VMX IDEXX 2019, and that concludes our presentation. Thank you.